Medication is a very powerful thing, and oftentimes people in other healthcare roles may not be able to see what it's actually doing for their patients, but as pharmacists, we're not only dispensing the medication, but we are following them from the beginning of their therapy all the way through completion.
That's why it has to be a healthcare team. You have the provider assessing the patient, seeing what is wrong with them, and then the providers come to pharmacy and they say, what do you think we should do? What medication do you think is appropriate?
There's something that people don't know about is that every order in the hospital has to be reviewed and verified by a pharmacist.
We're kind of the final check before medication is given to a patient, so if without that final check there could be potentially a lot of mistakes or things that should be improved upon.
Every single day we make life-saving interventions and we work with the team to make sure that the patients are safe.
I didn't realize how big of an impact we have because we truly are the specialists in pharmaceuticals and the medications.
I think most people think pharmacists as their neighborhood pharmacists, but the list is quite long of the different pharmacy areas, whether it be the outpatient pharmacy or even the different clinical sites of like Vermont Lung Center, endocrinology, cardiology, to the specialty pharmacy, to infusion, to the operating room, and the PACU or post-op or actually in procedure. And then you also have emergency room physician, to general medicine, to pediatrics, to intensive care.
And depending on what interests you, there is really something for everybody.
What I really like is the collaboration that I experience every day. Being able to collaborate with people across different campuses, different job titles, all with the common goal of making care accessible and affordable to patients.
UVM is, I guess, very much unique because it is this large academic level 1 trauma center with a community feel.
I think it really started when I did my interview here. They really wanted to know who I was as a person versus what I knew about pharmacy. They wanted to know what my favorite food was, what makes me happy, what drives me in life, what I'm passionate about, what I want to do with my career.
Everyone there is very kind and very helpful in teaching me the role and the responsibilities that come with it. Especially, I only joined the pharmacy last year, so this has been a whole new experience for me.
Having worked in other institutions outside of Vermont, you don't always feel that way and you don't always get that support, but that is one thing that I've really noticed at this institution is you will feel supported through education, through training.
Our leaders really encourage and reward curiosity. If you ask a question and you demonstrate interest, they are going to facilitate an opportunity for you to learn that.
You never feel stagnant in this role, and that's important to me.
I've been at the hospital for 35 years. I've done like tons of different things in my career, everything from director of pharmacy here to clinical pharmacist to working with the medical home to work in oncology and the cancer center. So I've really been able to have a lot of different careers and stay right here.
My favorite part about my job would be seeing how the medication that we are teaching them about and dispensing to them is changing their lives, and whether that be recovery from a disease or giving them a few extra years of life or providing them with the stability to go on and do what they love.
I think that's the whole reason why I went into healthcare, that I enjoy helping people. I really enjoy the knowledge base I have to implement, to help patients and make a difference.